Welcome to Insights, brought to you by Manatee Cancer Center. Insights is a multi-series podcast of cancer-related subjects, giving perspectives from specialists and cancer patients as they tell their real-life stories of victory, such as Sharon.
I'm Sharon Blake, a breast cancer survivor. I want to share my story of the most challenging and rewarding journey of my life. I hope you find these podcasts full of wisdom and inspiration.
The complete Insights series may also be viewed at manateecancercenter.com. With Sharon's Insights and a podcast sponsored by the Manatee Cancer Center, and we have a couple of other guests back. Of course, we have Sharon, who is our Sharon from Sharon's Insights. Welcome back.
Thank you.
And we have a couple of other guests now. We have Dawn Patterson, who is the business manager for Chanel, as well as the makeup specialiste for Saks Fifth Avenue in Sarasota, Florida. Thank you so much, Dawn, for being here today.
Thank you. It's my pleasure.
Absolutely. Delighted to have you, as well as, of course, we've had Dr. Koshy on before. This is Dr. Mary Koshy, and she's a radiation oncologist with the Manatee Cancer Center. Thanks again for coming back with us.
Thank you.
Wonderful. Well, on the second part of our journey of this particular segment, we're going to talk a little bit about makeup and those kinds of things. Mm-hmm. When you started to deal with some of the issues with the mastectomy and things like that, once you were in the healing process, you started thinking about your femininity maybe a little bit again. How was it for you when you first were facing it, and what kinds of things did you think about as far as your appearance?
I had a good friend who went through the same thing. She had a bad time. She said, when you see yourself first in the mirror, you're going to bawl, you're going to cry, you're going to think, that's not me. Mm-hmm. I was fortunate because I had my surgery at Manatee, and I had 3 nurses with me who I work with, and we all stood there in front of the mirror the day, 2 days after my surgery, the day I was leaving the hospital. And we uncovered the bandages because the nurse was going to put new ones on. And I just looked at myself and I thought, it is what it is. Right. Let's get on with life. And then it was like, I had 6 weeks off for the surgery, and then I went back to work. Okay. Went back to work bald. Right. Bald and beautiful. Bald and beautiful, of course. Right. Didn't have any bra or anything, and I felt comfortable. And then I was told that, go to see a specialist to get a mastectomy bra, the wig, got the wig, wore it once, and then hooked it on the computer screen at work. It was like, ugh. Okay. Was it because it was uncomfortable for you? It was uncomfortable, and I'm going through hot flashes. Sorry, y'all, but it's life. It is part of the journey. It is what it is. Yeah, that's right. So, I'd sit there. Sometimes I put. I got scarves from everybody, and I got friends in Miami who knitted me little hats, and they gave me extra to give to Dr. Koshy's office so we could give them out. And I just wanted to be free. Right. And the baldness did it, and I was getting too hot with everything on my head. Yeah. And of course. And I remember my first hot flash, it started in my hands and just went up the arm and up the neck, and that was it. But it was an awful feeling. I bet. Yeah, but when I went to get the bra, she said to wear it every day because your posture changes, which I didn't realise. I wore it 2 days and didn't wear it for like 3 or 4 months. Oh. Yeah, I just didn't feel comfortable in it. Okay. And I wore it a few weeks ago, and I had so many compliments about my hair and makeup. Oh wait, now let me make sure I'm understanding this. You wore the bra for a few days, weren't comfortable with it, just stopped wearing it for 4 months, and then one day decided to wear it again, the same bra. Yeah, to work. And then basically within 24 hours, folks are saying, God, your hair and makeup, you look fantastic. Yes, and I said, the hair's just growing, the makeup's the same, it's still a mess. Sorry. Well, that's why we have Dawn is here to help you. She's with Chanel and Saks Fifth Avenue. I know, but I'm no good with makeup. But I had so many compliments from doctors, from nurses, from staff. Wow. Yeah. How neat was that? Yeah, it was. And I said, it's only because I got the boobs on. That's it. Isn't that amazing? Yeah, it is. Wow. It's weird how people look at you. Yeah. You know. Yeah. So that was it for me. It was wearing the bra, and I still don't wear it to work. Okay. I'm sorry. and I'm sure you still get compliments anyway. Though. I do, because I beat them up if I don't know.
She either beats them up or gets hugs. Gets hugs, right?
Yeah.
Now, one of the questions I have for you, Dr. Koshy, is obviously, you deal with a lot of patients and
Sure.
that have to deal with mastectomies and things like that. What is the common circumstance? Is it very similar to what Sharon has dealt with? Is it that the women feel not like a woman, or what do they deal with emotionally at that point?
I think it's a personal journey emotionally for everyone that might be different, just depending on your circumstance after a mastectomy. But I think the process of kind of getting back to who you were and what you were before all of that is critically important. And that's different for every different individual.
Right.
But things that kind of might seem small, like hair and makeup, are actually really important, and kind of just going back to who you were and putting the cancer behind you and moving forward with life.
Right.
So
now, dealing with radiation, as that's one of your specialties, really, hair loss, is that an absolute, or is it extremely common, or how common is hair loss once you have radiation treatment?
Right. So radiation therapy itself does not cause hair loss because radiation is all local. Essentially, we're treating just the breast or the chest wall, and it's directed just to that area.
Okay.
The side effects that arise from radiation are pretty much limited to that area.
Okay.
And really, with modern day radiation therapy, the side effects are limited to maybe some fatigue and skin changes in the breast or the chest wall, the area that we treat. So hair loss is not a side effect that's seen with radiation therapy. It is, however, associated with certain kinds of chemotherapy.
Okay.
And so usually in the journey, of treatment for women with breast cancer, systemic chemotherapy is typically given before radiation. So when patients come to us, they may have already lost their hair.
I see. Okay. Now, are there some more invasive or non-invasive options that are now available to women than there were, say, even a few years ago?
Sure. I mean, I think as with any cancer, we've seen the evolution of different modalities in breast cancer, certainly imaging modalities with the advent of MRI and so on. From a surgical viewpoint, the standard of care for early stage and advanced breast cancer, depending on what stage it is either lumpectomy followed by radiation or a mastectomy. So those two have essentially remained options for women over the past 20 to 30 years.
Okay, and on a previous podcast, we had also talked about the necessity for either a lumpectomy or mastectomy, depending upon a number of factors. Would you just touch briefly on what those might be in terms of one or the other?
Sure. So breast conservation, and that really entails doing a lumpectomy followed by radiation, has certainly become more popular over the past 3 decades. 40 years ago, women didn't really have a choice. Right. If you had breast cancer, you had to have a radical mastectomy. There were no options. And over the past several decades, we've seen that breast conservation, doing a lumpectomy followed by radiation, is just as good as doing a mastectomy, that there really is no survival difference for these women. And so that's become an option for them. Which option to choose is a very private, very personal decision. And it's important, I think, to be educated about the different options and understand the pros and cons of both choices. And those are, options that your physicians will go through with you to help guide you to what the right decision is, for you as a patient.
Sure. And let's say in the case of a double mastectomy, once the treatment has all been taken care of, whether it be the mastectomy and then radiation and or chemo or whatever those procedures would be, at that point, is there would there be breasts would be replaced?
Sure. So reconstruction after mastectomy is an extremely important, I think, topic to educate yourself about. Certainly that helps women, I think, just again, move forward with life, after having a mastectomy and the chest wall remains. Many women choose to go on to have reconstruction, whether it be immediate reconstruction or delayed reconstruction.
Right. Okay. And in this case, actually, Sharon, I think that's something you're weighing that option, or is that something that you're going to be doing?
I will be doing it, but me and Dr. Koshy talked the other week, and we were going to wait. We have to wait a year after radiation's finished.
Okay.
Before I can really sit down and talk about it. So July, but I think we've put it off till next year. I'm in no rush for more surgery.
Sure, I understand.
So, but it's always there as an option.
That's great.
Yeah.
Okay.
So I'm
Beautiful.
fine the way I am.
You are. You're fantastic the way you are. You're awesome. You're
Thank
awesome.
you.
Now, for some folks that want to look a little more glamorous or get some of their femininity back, we're going to talk now with Dawn a little bit. Dawn, as I mentioned, is the business manager for Chanel, as well as a makeup specialist at Saks Fifth Avenue in Sarasota, Florida. And what is your involvement with the Manatee Cancer Center, or specifically with these organizations? What do you like to do?
How I became involved with the Manatee Cancer Center is one of my dearest friends, Joan Russell, was diagnosed with lung cancer, and she was my mentor for 20 years as a makeup specialist. We worked together at Saks and had a wonderful time sharing all of our tips and techniques with many women over the years. When she was diagnosed, we were I'll never forget, we were listening and sharing. That was our big thing that we would do for each other. And she said, okay, what can we do to help these women? Because feeling good is looking good. So we came to Dr. Koshy and to Maggie and said, let us help you. So the brainchild was created of Monday Makeovers, where we bring Chanel on location. Chanel is just the ultimate house of luxury, and to be able to pamper all women and caregivers and previous patients who have been through their struggles and battles and been victorious. We pamper them. We show them how to create that lash line when they have lost their lashes or their brows, and show them the latest collections right off the runway. And we were able to also introduce local nail salons and oncology massage therapists. So it's an absolute day of beauty. And we're now, our second annual Pink Martini Spatini will be in October at the Center for Building Hope, and we're very excited for everyone to attend, so we can share all of the knowledge and pampering to help each woman as they go through each day.
Wonderful. And that, again, is going to be held at the Center for Building Hope, the Pink Martini Spatini. October 18th, as I was told, is the date. And, of course, you can check the website. Is it Center for Building Hope? centerforbuildinghope.org. centerforbuildinghope.org. Please go to their website and find out more about how you can RSVP and become part of the event, whether as someone who is a friend, a family, a cancer survivor, somebody with the facilities, whether you're a nail specialist or hair specialist. I'm sure that you're always welcoming folks to participate as part of that as well, right?
Definitely. Anyone that would love to come in and volunteer their time to touch everyone's lives, because the one thing that Joan Russell did teach all of us is to love one another. So I would like to really extend that invitation to all to come and participate. And if you are not able to make on the Monday Makeover, you can always find me at Saks Fifth Avenue in Sarasota. My phone number is 941-364-5374, and we will pamper you right there, right then and there, at any wish that you would like to do, whether it's special occasion or you just want to have a fun girls' day out. So
how nice. Now, when you said about the Monday Makeovers, is that every Monday or specialized Mondays, and where do these things actually take place?
We host them at either location, either the west or east location. They're once a month.
Okay.
And so on the Manatee Cancer website, you're able to sign up, because sometimes we can have a group of 20, or it can be more intimate as a group of 10. But we want to reserve your time, so please.
And how much time is it? Usually like an hour or 2 hours? How much time would they need to map out? Not that they can map out the whole day.
Just for it's very laid back, casual, because it's all about listening and sharing and being there for one another.
Yes.
We usually do from 10 to 12, but we never turn anyone away, and we will stay as long as you need us.
That's so wonderful. And this is at Saks, is that correct?
Well, this is actually at the Cancer Center.
Oh, right at the Manatee
Yes,
Cancer Center.
right
How
there.
fantastic is that? Now, of course, you're there. I know in your busy day, do you ever have an
Sure.
opportunity, Dr. Koshi, to go down and say, hey, you think you could just put a little, little rouge on my cheeks, or how does that work?
Well, yes. I've known Dawn for a long time by just going into Saks and asking her to do that for me.
Right.
So I would love doing that. But no,
Sure.
the Monday makeovers have just been wonderful.
I bet.
They really have. And it's, I mean, as Dawn said, it was the brainchild of one of our patients, Joan and Dawn, who have been best friends for over 2 decades. And these women are amazing because what they do is make other women feel wonderful and beautiful about themselves. I mean, they've devoted their careers to doing this.
Yes.
So it's wonderful to be able to have their expertise in our cancer center. And as Dawn said, it's just a time of intimate sharing for women who are going through the process of getting treatment. It's time to just get together and laugh and, spend time looking at makeup and be able to have the expertise of Dawn there and Joan in the past. So it's just, I think it's just a special, bonding time and a time to just feel really, great and beautiful about yourself, which is important, in every day, but even I think more so importantly for people who are going through this journey.
Absolutely, that's very, very well stated. So, how many of these have you attended? You're thinking, oh, Doc, I've got to run down the hall. I'll be back in a few hours.
I've only been to one.
Oh, only one?
Yeah.
Oh, okay.
And it's a shame that I don't go to more, but my days off, I have too many appointments.
Okay.
So I only have like one day off in the week
Yeah, I understand.
from work, so
Sure.
I just book appointments. But I want to go to more because I
Well,
want to be more involved.
Yeah, absolutely.
Yeah.
That's really, really important. As you said, I think as you're regaining your confidence and your femininity and all that, and what Dawn does is so important. It really is a great thing that you do, and of course what you do also, Dr. Koshi, and all the treatment and all those wonderful things. So Sharon, going forward, what do you foresee? Are you going to get a new hairstyle, or what do you think is going to be happening next? You got that great curly hair.
It's going to do whatever it's going to do. I don't know how it's going to turn out, but I'm just letting it grow to see what it looks like.
Right.
But I did like the short hair, though.
Yeah. Oh, you liked it real short?
Yes. When it
Okay.
first started to come in, it was like, the curls are here, but it was like really tight curls. And I would be prepared if a friend of mine was going through it, I would shave my head.
Good for you.
I would do that to support her.
What a dynamite thing! I'm not surprised by that at all. I'm really not. And I just want to say one last moment before we're going to be wrapping up here today, Dawn. Please let them know again how they can get in touch with you over at Saks Fifth Avenue in Sarasota, Florida, for more information about either the Makeover Mondays or if they want to come and see you at Saks.
Absolutely. You can go on the website at for the Manatee Cancer Center to book your reservation when we do our Day of Beauty on Monday makeups, or you can reach myself, and I have wonderful staff that will be able to pamper anyone at any time. Our number is 941-364-5374, or you can email me at Dawn_Patterson@s5a.com.
Wonderful. And of course, Dr. Koshi, they need to be able to get in touch with you as well. Please let them know the website or things like that.
Sure, and I'm with Manatee Cancer Center, so it's www.manateecancercenter.com, and our phone number is 941-748-4324.
Wonderful. And again, on a final note, the Center for Building Hope is their centerforbuildinghope.org website if you want to find out more information about those kinds of things. And we're so grateful for them coming in a little bit earlier in the podcast and discussing the great things that they do in helping everybody through this. And it's so nice to have you with us, Sharon. And my name is Mike Cradlack, and we're here with the podcast, of course, for the Manatee Cancer Center. And we so appreciate you tuning in with us today. And we hope to see you again another time. Thank you. Thank you for listening to Insights, produced by the Manatee Cancer Center. For more information on upcoming podcasts, visit www.manateecancercenter.com.